Well, June is National Healthy Homes Month, and my name is Zoe Schaefer. I'm a nurse practitioner with the Blackhawk County Health Department. So I just wanted to talk to you a little bit about asthma. So I want to highlight the importance of reducing any exposure to allergens and asthma triggers within the home, because many of the same asthma triggers can also trigger an allergic reaction in people who don't even have asthma. So an allergen is something that causes a mild allergy sign or symptom or an allergic reaction. And allergic reactions can either be mild or very serious and severe. So mild reactions might be nasal congestion, itchy eyes, runny nose, sneezing, stuffiness, but more severe reactions would be difficulty breathing and the need to go to the emergency room. So asthma is a lung disease. It causes people to wheeze and cough and be short of breath. And people with asthma can suffer from frequent periods of difficulty with breathing called asthma attacks. And during an attack, the airways swell and get swollen and start to swell shut. And the muscles around them tighten and constrict, and the airways can produce very thick yellow mucus. An estimated 20 million Americans suffer from asthma. That's 1 out of every 15 Americans. And 62% of those cases are allergic asthma that's triggered by allergens, like we just talked about. The prevalence of asthma has been increasing since the 1980s across all demographics. There's another asthma called exercise-induced asthma, and those people just get attacks usually when they're exercising. Nearly 5 million asthma sufferers are under the age of 18, and it's the most common chronic childhood disease. It affects us more than one child in every 20. So asthma is slightly more prevalent around African Americans than Caucasians. And asthma is not contagious. You can't catch it from somebody else. But it does run in families. So if you have a family member with asthma, you're more likely to have asthma yourself. Children living in urban areas, in crowded homes, or unclean conditions can have more risk for developing asthma because they're getting exposed to more allergens. So the household triggers that can cause asthma attack or allergies include tobacco smoke, mold that might be growing in the home in wet areas, pet dander, pet hair, dust and dust mites that might be in pillows and mattresses, rodents such as rats or mice, and air fresheners can be irritating too to some people. There are several things that you can decrease those allergen exposures in your home. So you can keep your house clean, make sure that it's free of dust. Some people are allergic to dust. Identify and fix those water leaks that might make a watery, damp area that would encourage mold growth. And then vacuum often, and especially if you can use a vacuum cleaner with a HEPA filter on it. Keep food stored in tightly sealed containers so that rodents aren't encouraged to be sneaking around in your cupboards, and clean up any crumbs and drips and spills immediately to try to keep the house clean. So keep people with asthma away from dust, smoke, and molds, because that can trigger an asthma attack, and we don't want to have that happen. And do not smoke in the car with your children. Do not smoke in the house. That excess smoke exposure can cause kids to even develop asthma. So clean pet hairs from the carpet and the furniture, and change bed sheets often, and wash them in hot water, and use allergen-resistant mattress and pillow covers, because mattresses and pillows can have that dust that can come out of them. So get medical advice and follow your doctor's instructions if you do have asthma. So seek medical attention if you're having any difficulty breathing or breathing problems, and get emergency medical care for any bad attacks of shortness of breath or wheezing. And then take all the prescribed medications that you've been told to take by your doctor, either to prevent an attack from happening or when you have an attack to lessen the symptoms. So contact your doctor about any unusual reactions to food or plants or animals or you think you might be allergic to. You can get some allergy testing to detect which things are bothering you. And then find out what allergies you have so you can avoid these potential asthma triggers. And then seek emergency medical attention immediately for any severe allergic reactions. People in the emergency room can give, EpiPens and steroids and breathing treatments, so it's important to seek that emergency care when it's needed. I hope you have a wonderful June and happy Healthy Homes Month, and I hope you liked learning about asthma today.